Does hospice speed up the process of death? Okay, the short answer is no, obviously, but I get this comment all the time. This is a common misconception, so I'm going to take the mystery out of it. I'm going to talk to you about the Comfort Pack. This is the box of medication we give almost all of our patients on hospice. What's in it? Why are we giving it? And why are we not giving it sometimes? The Comfort Pack. It usually has 8 medications in it. This will depend on which hospice company you go with, but in general, this is what should be in there. Number 1, morphine, or another name for that would be Roxanol. Number 2 is Ativan. The other name for that is lorazepam. Number 3 is Haldol. The other name for that is Haldoperidol or something like that. Number 4 is Zofran. Number 5 would be Levocin. And if we didn't use Levocin, we would use something called atropine. Number 6 is Tylenol, which is usually in suppository form. Number 7 and 8 is bisacodyl. It's the same drug, but one is in tablet form and one is in a suppository form. So all of these medications are usually given either sublingually, meaning in the gums or under the tongue, or rectally. Rectally because we have a lot of vasculature in our rectum and medications absorb quite well in the rectum. So these are the basic medications. This is the basic thing we will give almost everyone on hospice. Of course, we can give other medications. We can use other pain medications. We can use CAD pumps. We can use something called a Macy catheter. We can use pain patches. There are several other things we can do. The Comfort Pack is the basic level of care that we give almost everyone, just in case. We have it in their home just in case they may need it or something happens. So let me tell you what each of these are for. So morphine. Morphine is the one that gets the baddest rap. And it's the one I love the most because I think it helps with symptoms the most. So morphine under the tongue can help with pain or shortness of breath. Many people think that hospice just gives morphine because someone's dying. That is not true. We are only giving it if they're showing signs of pain, signs of shortness of breath. This little bit of morphine just helps relax the central nervous system, relaxes the diaphragm, and just makes the person feel better. So if they feel air hunger or shortness of breath, a little bit of morphine will take that away. If they have some pain, a little bit of morphine will take that away. It has been clinically proven through studies that the use of this type of morphine in this type of way on hospice does not hasten or quicken death. It just helps a person die more peacefully. Ativan. Ativan can be used for a number of things. It can be placed under the tongue and just absorbed. It can be crushed and placed under the tongue. Just depends on how the hospice company works or how you as a caregiver are choosing to use it. This can help with anxiety. It can help with terminal agitation. It can help with shortness of breath. It can just help with overall restlessness. Haldol. Haldol is an older drug that people used to use in psychiatry a lot for people with schizophrenia. However, they also found that it really helps with terminal agitation in general, especially with someone with Alzheimer's or dementia, and then nausea and vomiting. This usually comes in liquid form and it's given underneath the tongue. Zofran is a under the tongue medication that many people who are not on hospice also take. This is just for nausea and vomiting. We give it to people on hospice if they have nausea and vomiting. We place it in the Comfort Pack just because this is a common symptom that people can experience while on hospice. So Levocin, or another drug we may use, is atropine drops. And atropine drops are not to be placed in the eye, despite what most of the boxes say, because they are eye drops. But on hospice, we use them in the mouth. And this is for terminal secretions. So people, AKA the death rattle. People know terminal secretions as the death rattle or the gurgling that a lot of people hear their loved ones have at the end of life. Levocin is a pill that's placed under the tongue. Atropine are drops that are placed in the mouth. Both of these medications dry up those secretions to help decrease terminal secretions and get rid of that death rattle sound. Tylenol suppository. This is something that I feel like we underutilize in hospice. Like I said, our rectums are very vascular and they absorb medication very, very well. To me, it's a great way to control symptom management, and Tylenol suppositories are used for end-of-life fevers, which happen a lot. Some people don't like using them because the idea of having to give someone a suppository does not sound fun. However, I have found that Tylenol suppositories can be really effective for the fevers and just for generalized pain. And bisacodyl. So bisacodyl, any hospice company can use any kind of laxative. Typically, bisacodyl suppositories are used just because at the end of life, people can be constipated and people think they shouldn't be having bowel movements because their loved one's not eating, when in reality, they should be still, and being constipated is really uncomfortable. So we always try to give bisacodyl suppository so the person can have a bowel movement. It also comes in pill form, so if the person is able to swallow, they can take that as well. So there was an actual study that was done with hospice patients who were taking morphine at the end of life to see if the morphine we are giving on hospice is actually shortening their lives. And the results were no. It has been clinically proven that the morphine that we are giving on hospice is not hastening or quickening death. It is just allowing the person on hospice to die more peacefully. And just to be clear, we are never just giving morphine on hospice to give it because someone's dying. We are only giving it if they're having pain or if they're having shortness of breath. So not everyone on hospice even gets morphine, but if they do, it is not hastening their death. And this study proves that. Lastly, on hospice, the nurse and the doctor will always review all of your medications. So yes, you will get this comfort pack, but in general, like I said, we will review all of your medications. We will stop the ones that we don't think are necessary, keep the ones that we think are. You have a say in this too. If you're like, I don't want to take any meds anymore, I'm sick of taking this, I'm sick of taking that, you have every right to not take those. But the hospice company will review all your medications, give you this comfort pack. You may never take anything from the comfort pack, but it's there to have in the home just in case. And we can also use other drugs outside of the comfort pack to help manage symptoms. It all depends on your care and your needs and your hospice team. I hope this information helps decrease the confusion around medications on hospice. Let me know if you have questions in the comments, and don't forget to subscribe for more death and dying information.